integrase inhibitors, makes sense, it doesn't integrate in there. It blocks the action of integrase, okay, which is a viral enzyme that inserts itself into the viral genome, into the DNA of the host itself. So it gets into the cell, okay, the virus might get into a cell, but it blocks the HIV virus from getting into the inner workings, okay, of the cell itself. So it's not allowed to use the camera and take all those bad selfies, okay? So it prevents replication of that little copy machine that's going on inside the cell once the virus is in there. So the virus is in there, it just can't make copies of itself, which is, again, a very, very good thing. So overall, they call this whole system HAART, highly active antiretroviral therapy. Okay, these are these cocktails, this group of drugs that people, and they change constantly, and people are constantly monitored, and the drugs are changed quite frequently. Generally speaking, they're going to be put on one of the nucleosides, one of the first ones we talked about, one of the NNRTIs, the non-nucleoside reverse transcriptase inhibitors, and a protease inhibitor, okay? And sometimes other things are added. Sometimes there are some products that are two different drugs mixed in together. And remember that these drugs change frequently. And as new things come out in the market, does anybody remember the significance of a drug being fast-tracked by the FDA? What does that mean? If something's fast-tracked, remember how long that process takes getting through the FDA approval? They cut the line. They cut the line, okay? So they allow the process a shorter period of time for something which is life-threatening or rare, okay? And it may be that these drugs are released to patients as long as they're considered reasonably safe, okay? You have somebody who's dying of a disease. They may be allowed, they'll be given that orphan drug status, okay? There are different levels of fast tracking. So lots of times when these new drugs come out and they have some reasonable research behind them, okay? They're showed at least to be somewhat safe. People are allowed to take them, both through being an orphan drug, and the process is going to go faster. And they might put some money behind it. They might actually give them tax breaks, but something to get the drugs to market because they're saving lives, okay? So you will see these drugs in the fast track process. And when I looked up the new drugs that are coming out, there were some that were going through that, okay? Education of our patients, education of ourselves is vital. We do actually have a speaker for the Connecticut Dental Hygienists Association. They actually asked us if we had a place here at Phones or in the UB community to host this speaker. Did any of you get to see Karina Danvers at, you did? Did a couple of you, the person that spoke?
About her having AIDS?
Yeah. Not all of you did though, right? Some people came back into the room. I think maybe, were you a page or something?
No, I was just in there.
Yeah, okay. She was fabulous, but you guys were off at your own programs. But she's going to be doing, she talks about HIV and there was another topic, other infectious diseases she's going to be talking about. But she's an incredible speaker, and she's going to come in with CH8 and talk about some of the new developments. So I'm really excited. It will be in March or April. We'll let you know when it is. We think it's going to be like a Wednesday evening, which I know it's hard to stay sometimes, but we'll probably have like food. Okay, and get some extra information for your patients, so that should be really good. Remember again that oral manifestations of AIDS are really, really significant, and that you're going to encounter this, okay? So just to give you an idea, this is just a list of these drugs, and the ones that I have highlighted are the drugs to know, okay? Do note that the drugs, a lot of the antiviral drugs have INE or VIR, okay, in their suffixes, so it makes them easier to remember, okay? And these are the drugs that I want you to know. Okay, chronic hepatitis we're going to talk about pretty quickly, just a few slides here. You know hepatitis involves the liver, right? Anything that has ITIS means inflammation, like periodontitis, right? Most chronic hepatitis infections are because of hepatitis B and hepatitis C. I forgot what letter we're up to at this point, but those are the most common one, okay? Hep C is the most common for risk of chronic, if you will. Hep B seems to be more treatable at this point. We have more drugs to fight it, okay? Symptoms may be yellow jaundiced skin, anorexia, which is actually a loss of appetite, okay? It's not just the drug of trying to be skinny, it's a loss of appetite. And malaise, okay, which is a feeling of overwhelming tiredness, not just being a student, but really overwhelming tiredness, right, like you feel right now, after studying for 3 exams this week. So that is how someone might appear that's not very well controlled, that has hepatitis, yellowish skin, yellowish eyeball. Usually you'll put the eyeball more significantly. These are some of the drugs used to treat this, okay? Notice the INE and the VIR suffixes on it. Many of these are taken for people that have chronic hepatitis for years and years, okay? A lot of them are very well tolerated, okay? And they're considered better. We do have some interferon therapy that we'll talk about, but they're considered better for suppressing the virus than some of the interferons. And they should not be stopped suddenly, because we know when we stop something suddenly, okay, something that's laying there dormant or very low level has a tendency to flare up. And stopping some of these drugs suddenly may cause a very incredible flare-up that may be fatal if it overtakes the person. So I did mention the interferons. Interferons are one of those things where they've made drugs that copy the endogenous, remember the endogenous, you guys all get the endogenous and the exogenous things?
Yeah.
Okay.
Endogenous.
Endogenous. Okay? Because the drug doesn't impart a new function to the body, right? It does the same thing as the body. So interferons are endogenous proteins that we've developed in order to mimic them how they are in the body. They have antiviral, cytotoxic, and immunomodulating action, okay? So they actually do something that the body's not doing for itself. And these interferons are used in multiple applications to treat multiple sclerosis, okay? Hepatitis B and hepatitis C, age-related Kaposi sarcoma, which is actually pictured here. Kaposi sarcoma is actually an invasive cancer that takes over a lot of the blood vascular types of tissue. So you'll see people with oral lesions that look like this, and often purplish lesions all over their face. It seems to start with. And often these lesions that are seen in the mouth and on the face are the thing where they will now say this person no longer is just HIV positive, okay? They have AIDS. This is one of the lines that's drawn in the sand there. So hopefully this isn't something you're gonna see. Yes, Layla? Are you allowed to treat it? These areas do bleed very rapidly, but we also know that someone with, an infection in their mouth needs to be treated. So with care, yeah. Hopefully it doesn't get to this point, but with care. And it's also useful in treating a type of leukemia called hairy cell leukemia. There are some adverse reactions that may be severe, including myalgias, which is like flu-like symptoms, fatigue, headache, arthralgia, CNS effects. Importantly, I want you to note that some of the interferons have effects in the mouth, taste perversion, taste changes, people getting recurrent herpes labialis, if you will, and excessive salivation. There are a few drugs, just so you know, that are FDA approved for treating hepatitis C. You don't have to memorize them. I just wanted you to be familiar with them. And they do have some adverse effects. So your takeaway from today is that educate yourself and educate your patients about these drugs. These are drugs that are used to treat things that have symptoms in our neck of the woods, if you will, okay? Oral lesion identifications, you have a whole semester class, okay, next semester here with your oral pathology class. And so you'll be looking at the differentiation of these lesions in the mouth. Important aspect of educating patients on how to use the drugs. Most of those oral rinses are swished through the mouth and swallowed. Okay, an exception might be one that contains sugar for someone who has diabetes. Maybe they would spit it out. Why do you think we swallow it?
First pass.
It stays there, but it gets in contact with all the aspects of the mouth, okay? Most of it's not systemically absorbed, okay? So we would only want to pay attention if someone either could swallow it or for the sugar content, okay? Be aware of those drug interactions we talked about with drugs that we may recommend, and be aware of the clinical implications. Thank you guys for your patience. We have a couple of minutes. And yes, I will get that to you as soon as I can. I try. Hi, Lou.